Well, President Akufo-Addo has warned that government will be forced to put the country under another lockdown if we fail as a people to adhere to the COVID-19 preventive protocols. A number of the new cases recorded so far have presented unfamiliar symptoms, including waist pains and sudden deaths without any underlying health problems at all. The development is prompting fears Ghana could be harboring a new strain of the virus. If so, how come? Which of the strains are we dealing with? Listen to Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje, speaking on the probe with MFA Apau.
We've been doing sequencing periodically, and as at the last time the president spoke, I think that was when November, we had not discovered any new strain apart from what we already had here. What we've done is that since the president spoke last, and we decided that for those who are coming in, we will test them, quarantine them, isolate them, and sort of do a sequencing. And that's when we realized that among those we identified, some of them had the new strains. Now, so it is not that they have entered the country yet. What we are doing now is that we are now going to look at the general population again to see whether in all that there's been a leakage into the country. And I think that's when that comes in. We'll let you know. So what we have, the new sequence we have, is that we've done that for those who came in since the last 2 weeks, since we've been detaining them.
2 weeks ago.
That's what we have been testing. For those who are positive, we test them, do the sequencing. That is what we've discovered that. But now moving into the general population to see that now we have found it here. Now let's look at the general population, whether in all those periods we've had some new strains in the country. I'm sure that one comes, we will share with you.
But he's asking specifically how we take care of those who have the new strain. Like, is it different?
No, what
is there any
do
special?
Is that once we isolate you, we keep you until you are negative. And so definitely you are not able to transmit the virus to anybody. But because the people have come in over a period, and also possibility that someone may have been negative at the time of testing but turns positive later, we need to look at the general population whether we've had some of such strains infecting into the country. And that's what we are going to do now. That's what we have started doing now.
It's surprising that we haven't started.
Oh, we've been doing a population-based screening long. I told you, as at even November, that was the last one that was done.
Yeah, but since we discovered this new strain.
Oh, this is 3 or so days ago.
Okay.
It takes a long, sequencing is not like a dipstick and you get the results. It's a whole process. So once the results have come in now, that's when we're moving to the next step.
Okay.
Now, how different or similar are the symptoms of the new variant? Dr. Yao Bediako is an immunologist at the West Africa Center for Cell Biology and Infectious Pathogens. He's telling us more.
So, for now, so far, all the variants, and this is not just in Ghana, all the variants that have so far been detected globally, none have been demonstrated to cause more severe disease. So it appears that, COVID, depending on who you are, in different people presents different. But so far, there is no evidence of a particular variant that causes more severe disease. Having said that, as I said, these two variants that have been identified recently, and that unfortunately we now have at least found at the airport, these have been shown to be more highly transmissible. So what that means is they are transmitted from person to person much more easily than the previous variant. So while they may not cause an individual to be more severely sick than the COVID the variants that were circulating previously, the number of people that a single infected person can infect if they have this new variant is significantly more. And so that means that, if in a household you had one infected person in the past, they may not, they will probably not infect that many people in the same house. But with this highly transmissible variant, the chances of more people in the household being infected is raised. The same for public transportation or in an office or in a crowded area. Now, if one person has that new variant, the likelihood of multiple people in their surroundings being infected is significantly increased. In fact, the UK variant is 70% more transmissible than the quote-unquote original strain. Well, I mean, scientifically, we are yet to fully understand what makes this virus more transmissible. Okay. But I would say that, yes, social distancing, yes, the virus may not necessarily travel further, although it may persist longer. We don't yet know why it is more transmissible. But certainly, the time required to become infected is probably less. So what I mean by that is if you are in contact with somebody who is infected, with the older variant, maybe, if you were there for 5 or 10 minutes, perhaps you would not be infected. With the new variant, that time is probably shorter. So whether wearing double masking, I think one mask typically, once again, masking only really works when everybody is masking up. Because when you wear a mask, you're actually protecting those around you, not so much yourself. You require those around you to also wear masks to in turn protect you. So I think with masks, as much as we are being asked to wear them, without full compliance, it can actually, it can cause significant issues. So we need everybody. I think that's why the president in his address was stressing that mask wearing is mandatory. And that is because if you wear a mask, but your neighbor who is close to you does not wear a mask, you are actually not protected. And so I think we need to be sort of encouraging people around us to also wear masks. If you get into a car and the driver is not wearing a mask, get out of the car unless he's willing to wear a mask. We have to realize that just wearing a mask ourselves, it does not protect us unless the other people are also wearing.
As an immunologist, they're talking about the way that this new variant seems to work, shorter period within which one can get infected.